Junior doctors have struck a deal with the government which would see their wages rise by 22.3% over 2 years. Medics in training have been locked in a pay dispute for 20 months, taking part in 11 walkouts as talks with the previous government stalled. Health Secretary Wes Streeting has now brokered a deal with the British Medical Association, BMA, for an increase of 4.05% for 2023-24, alongside an existing rise of between 8.8% and 10.3%. Junior doctors will also get a further pay rise of 6% for 2024-25, topped up by a consolidated £1,000 payment. This is equivalent to a pay rise of around 8%. The overall package represents around a rise of around 22.3%. Chancellor Rachel Reeves confirmed the plan as part of pay rises for millions of public sector workers in Parliament in a statement on the public finances. She told MPs, industrial action in the NHS alone cost the taxpayer £1.7 billion last year. That is why I am pleased to announce today that the government has agreed an offer to the junior doctors which the BMA are recommending to their members. Ms. Reeves added, "Today marks the start of a new relationship between the government and staff working in our National Health Service, and the whole country will welcome that." BMA Junior Doctor Committee co-chairs Dr. Robert Lawrenson and Dr. Vivek Trivedi confirmed that they would put the offer to their members. In a statement, they said, "It should never have taken so long to get here, but this offer shows what can be achieved when both parties enter negotiations in a constructive spirit." This offer does not go all the way to restoring the pay lost by junior doctors over the last decade and a half. However, we have always said that we did not expect to get there in one go. This offer, combined with the recommendation of the pay review body today, changes the current trajectory of our pay, even though there is further to go yet. They said the new government had shown it was learning to treat doctors with more respect and recognize there is a catastrophic NHS workforce crisis that needs addressing. Mr. Streeting kick-started talks with the BMA as one of his first acts in government. In a statement today, he said, "I am delighted that we have agreed an offer that finally paves the way to ending industrial action which has caused untold misery to patients and staff. Everyone agrees we can't have more disruption, more cancelled appointments, which is why my priority from day one has been to end this dispute. This has been a tough negotiation, but we have worked rapidly to reach a fair offer. I have been honest about the terrible economic inheritance left for this government, while the Junior Doctors Committee has been clear that nothing less than the offer on the table will bring these strikes to an end. This is a fair offer, fair to junior doctors, fair to patients and fair to the NHS. It also represents an opportunity to truly reset relationships so we can begin working together to bring waiting lists down and fix the broken NHS." The most recent strike, which took place just days before the general election, affected 61,989 appointments, procedures and operations, according to NHS England. Some 1.5 million appointments, procedures and operations have been postponed since December 2022 due to a wave of industrial action by different NHS workers. The strikes cost the NHS an estimated £3 billion. Dr. Rani Williamson, research fellow at IPPR and practicing NHS doctor, said, "It is brilliant to see the genuine promise of resolving this pay dispute. An end to strikes is a crucial first step to getting the NHS back on track. Yet the government must also address the root cause of why they've happened in the first place. The way the government and NHS staff negotiate is broken. Pay review panels have no direct seat for unions or staff, so strikes become one of the only ways to negotiate, rather than a last resort. We need to fix the process to avoid ending up with more strikes in a year or a decade."